best approach for repair of an inguinal hernia? Well, inguinal hernias represent perhaps the most common hernias of the abdominal wall and the groin area. The inguinal hernias are more common in men, but women do get them also, and they represent a place in the body in the groin region where some muscle layers come together, but they leave a gap or a space there that's known as the inguinal canal. And that canal in men is important because the spermatic cord and some blood vessels run down through that canal and down into the scrotum. So that canal can, over time, stretch or pull apart as those muscles separate from lifting or coughing or sneezing or regular activities and leave a bulge. So the signs of a hernia are a bulge that is bulging through at the groin region. Sometimes this can be very painful, but oftentimes it's not very painful, it's just uncomfortable and very visible as a bulge that needs to be pushed back in. So what's the best way to repair this type of hernia? Well, over the years the techniques for repairing inguinal hernias have evolved, and in recent probably 10 years laparoscopic or minimally invasive inguinal hernia repairs have been developed and really perfected. I was fortunate enough to work with one of the pioneers of laparoscopic inguinal hernia repairs during my training at UC San Francisco, well, now many years ago, over 15 years ago. And when that technique was being perfected, we learned a great deal about how best to repair the inguinal floor, how best to repair the hernia, and achieve not only the best, most durable repair, but also one that was the least invasive. And this minimally invasive approach and concept is one that's driven our approaches to hernias ever since that time. So today, I do think there is a best way to repair inguinal hernias, and that is a laparoscopic inguinal hernia repair, generally done with what is called a pre-peritoneal approach. And what this means is that the procedure itself is an outpatient surgery. It takes about 30 minutes in my hands or in the hands of any experienced laparoscopic surgeon who does these procedures. And it starts with being under anesthesia, asleep and comfortable, and a small incision made at the umbilicus, or at the lowest part of the belly button. And then a plane is developed behind the muscles that we normally think of where the inguinal floor resides. And after developing that plane behind the muscles, 2 additional small incisions are placed, and the space is created. The mesh material that we use is a light but strong mesh that is inserted and then deployed and maneuvered into just the perfect position. There it can be secured with some absorbable tacking instruments that place some absorbable suture or tack-like materials to fix it in position. And then that space is allowed to collapse. It is held open by some CO2 or some colorless gas that's placed within there, and that is then allowed to collapse, and the hernia is then repaired. We think that this type of repair is not only better and more durable, but also much more comfortable for people, allowing them to recover faster than they would from conventional or open repairs, where people experience more soreness, more pain, and more of a wound or incision that must heal. So is there a best way to repair an inguinal hernia? I do think so. I think many people of my training and of my generation think that this laparoscopic pre-peritoneal inguinal hernia repair with mesh is indeed the best method. It's one that I use for people who've had recurrences from previous repairs of different type, and it's one that I use for people who are having the first time repair of their inguinal hernia. I think generally speaking it's very successful with very few risks and side effects. I think it has a very low recurrence rate, and I think perhaps most importantly, it's a minimally invasive approach. And so people have the minimum amount of pain and recovery time while fixing this otherwise vexing problem.